Welcome to 12 to Your Health. I'm Dr. Derek Da Silva. The issue of bullying continues to make headlines, and it could be causing more teens here in New Jersey and across the country to take very drastic measures. Cosmetic dermatologist and cosmetic surgeon Dr. Kim Nichols is joining us today to talk about beauty bullying. Beauty bullying. I've done a lot of radio and television. This is a first for me. What is beauty bullying?
So beauty bullying is when adolescents are bullied about certain features, body or face, and are pressured into having cosmetic surgery.
How common is this?
I mean, it's becoming much more common. I see it in my practice a lot, especially because of the media, and everyone wants to be perfect and all these shows about cosmetic surgery, so we're seeing a lot more.
What is the most common characteristic, facial characteristic that children are bullied about?
I would say definitely the nose. So, you know...
To cover mine, you know, I mean, just to make sure.
Your nose is perfect.
Well, I don't know about that.
But I had one case of a child who came in at 9 years of age with their parents who wanted something done about their nose, wanted cosmetic surgery.
Wow.
Yeah.
Is it boys, girls? What is there a separation between the two?
I mean, I would definitely say more girls. I mean, because of course, you know, there's more pressure on girls to be perfect, but we're seeing a lot of boys too. So,
but is there another piece to this as far as education? Should we be educating children about this? What's your approach? Obviously, cosmetic, but what else is there?
Well, I actually try to convince the children and their parents to, you know, to hold off, to remember that, you know, nobody's perfect, and to think about, you know, what's most important about what's inside, because a lot of their, you know, features will change over time. So I don't want them jumping into any cosmetic surgery too early.
So next to the nose, what else?
Oh, we see, you know, chins. We also see even, you know, unfortunately I've seen girls at 12, 13 about their breasts. So you'd be surprised about how early it starts, the concern.
Now, do you focus more on facial stuff, or do you also do other procedures?
I focus mostly on the face, but also, you know, some issues with the body. And I try to convince them to hold off, and there's also alternatives that they can think about besides, you know, going under the knife.
Wow. Well, you know, again, something that's very new to me. I appreciate the information. What's the take-home message here?
The take-home message is to wait and to, you know, think about what's really important, and to realize that everything's going to change and the bullying will stop.
Well, thank you so much for joining us. I appreciate the great information.
Thank you so much for having me.
And here's a look at what's coming up tomorrow. Remember, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. It's time now for our Health Bite of the Week. Working out at home can be an effective way to shed those excess pounds, and you don't even have to break the bank to get results. Mayo Clinic offers these tips. Use ordinary household items like canned food instead of dumbbells, and use your staircase or kitchen step stool for step training. And once again, I'm tackling another one of your common health questions today. Are detox cleansers safe? Folks, the simplest thing to do when it comes to detox is this. Lots of water, as long as you have no restrictions with kidney disease or heart disease. Take something like milk thistle or schisandra for your liver. Very easy to do, and a good probiotic, the good bacteria, for your intestines. And if you have any health questions you'd like to ask, email them to me at 12toyourhealth@news12.com, or head over to my Facebook page and post your question there. I thank you very much for joining us today. Here's a look at this week's Community Health Calendar.